Hey everyone, I'm Burke. Welcome back for more rehab tips and tricks inspired by true patient cases and the questions and comments that you guys bring. So be sure if you find this video helpful, leave a comment, leave an observation, leave a question. I'll most likely work it into a future video. So thanks for joining me. Let's dive right in. On today's video, we're going to talk about gluteus medius tears. So this is actually one of the more common hip muscle tendon injuries that I see and treat here in the clinic. And it's common because this is Bend, Oregon. There's a lot of people who run, who ski, who cycle, who hike, who do all kinds of endurance activities and activities like skiing where you might fall, or mountain biking where you might fall and have a trauma to the side of your body, to the side of your hip and pelvis. And so what happens? Well, this is a person who comes into my office with complaints of pain on the outside of the hip. Sometimes it's diagnosed incorrectly as bursitis, and they get into the office, and what do we find? We find signs of muscle tendon dysfunction. So this is someone, the way we test for glute medius tears is through a few functional tests, including, can you keep your pelvis level when you walk? Is it painful when we put direct pressure against the leg if you're laying on your side to resist that motion of that muscle? And can you do things like a single leg squat well and functionally and without having problems in that tendon? So those are just a few of the quick ways that we might diagnose this in the clinic. It's confirmed with an MRI or an ultrasound. And usually the clinical tests are pretty good. They're pretty accurate. The cluster of tests, if we do a number of those things, and we combine it with a history of repetitive overuse, for example, or trauma like a fall on the outside of the hip, that's usually pretty good. So if you have those signs and symptoms and you've had this problem, what can you do about it? Well, let's get right into treatment. So the first thing, this is a muscle and tendon. It's a force producing unit. It's what keeps your pelvis level. And so anytime you are weight bearing, anytime you're walking, standing on one leg, doing anything like that, you're putting a load through this tissue. And so it's normal that that is going to be the time when you might feel some pain. So the first thing that we're going to do is suggest some modifications. If you can avoid as much as you can those things that produce or provoke your pain, obviously you do what you have to do to walk to the supermarket or to do your job or to get to and from school, whatever that may be. But the extra stuff, training hard for that longer run or skiing a lot on it, those are kind of things we're going to say dial back on those until this is better. Next thing we're going to do, modalities for a muscle and tendon tear, and that's hot and cold. I get asked all the time, which is better? Is cold better? Is heat better? Well, cold is not just an anti-inflammatory, but it's a powerful analgesic, meaning it's a painkiller. And so I'll always recommend cold if a muscle tendon is sore, because that's pretty superficial. You can usually impact it with a good cold pack. So we'll say yes, cold, 10 to 15 minutes. And the question of heat has to do with maybe what stage the injury is. If it's a little bit further along and it's not the first few days when it's really lit up, heat is great too. I know I love Asian medicine, acupuncture, things like that. And in those treatment modalities, heat is often primarily recommended. It increases blood flow, it helps circulation, and that helps healing. So yes, heat is great. Combine the two, 10 minutes of one, 10 minutes of the other. Should you finish with cold or heat? Honestly, in all these years, I've had folks try everything and I haven't seen anything definitive. So do whatever feels best for you, but try both of those in combination. Third strategy, a little bit of a compression sleeve of some kind, whether it's hard to ace wrap the outside of your hip. It's a tricky area anatomically to get an ace wrap with any kind of compression. They make special braces for the hip. I'm not convinced that those are that useful, but you could try a thigh sleeve. It's not going to cover the outside of the hip where the pain is, but it might be a little beneficial. It might distract you some. So that could be something that's worth trying. Tight compression shorts like cycling shorts or exercise shorts that have some compression to them, those might be handy and give you some relief. That's not the most important factor. So if you can't find a solution that fits in that category, don't worry too much about it. The fourth main category we're going to get to today are the loading exercises. Now, this is really where we're going to imagine a tear in muscle fibers. So you've got fibers that are long lines, long strings, and those have been breached. There's been a gap created between them because of micro tearing or macro tearing from trauma. That breach has to fill in with new tissue, and that new tissue in the early stages is weak. It's not very strong. It's easy to disrupt. So the key for the exercise stage is it's got to be progressive. It's got to start kind of easy and get gradually harder as your tissues become more mature, they heal further, and they can handle more force until you are basically overcorrecting, you're overtraining to the level of function that you want that muscle and tendon to have. So with a rehab for a tendon and muscle, we're doing similar things. We're going to use short doses of higher intensity exercise and loading in order to trigger a positive response in that muscle and tendon that's going to help it heal. It's going to make it stronger. So let me show you a few of my favorite go-to exercises for rehabbing this muscle. Let's go. Okay, so when we're first rehabbing a muscle tear or even a bad strain, we're going to start offloaded. That means we're going to start laying down or sitting because standing puts just too much force through it. So the simplest way to begin to train that, let's say this is my left glute medius, it's right here on the outside of my pelvis and hip, is I'm just going to begin to do some glute squeezes in sitting. This is a very safe, very easy way to get started. I'm just basically squeezing my glutes. I can do the same thing laying down. Just going to squeeze and hold. I want to hold this for about 30 seconds. 30 seconds is kind of a magic number in isometrics like this, where 30 seconds is long enough to begin to produce some of the positive rehab changes that we want to see in that muscle. While I'm here, I can do a few other things as well. There's no reason I can't train some of the other important stabilizers for my hip. So I'm going to bring a hand up or two hands up and put a little pressure down into my leg like this. This is also an isometric. I'm going to hold this 30 seconds like that. You can do both sides. It's always good to do the uninvolved side, even if you have pain just on one side. The other side can be very informative. You do get crossover when you rehab or train in non-injured, uninvolved sides. So definitely do them both. Third thing that we can do is a little straighten of the leg like this. And I'm going to call this 3A, and then 3B would be to just go ahead into a straight leg raise like that. Good control, nice and slow. Okay, and then number 4 is going to be an inner thigh squeeze. You can use your fist here. You can put a pillow in between your knees like that. And I'm just going to squeeze and hold 30 seconds. Now, all of these so far have not directly put stress on those torn fibers, and that's deliberate at this stage. This is the early stage. Those fibers need maybe a little bit more time to recover. So the first week to even 3 weeks, you might be doing stuff like this, where you're just keeping everything going, but you're not being too direct. You're not challenging those fibers too much. Now, how do we begin to challenge them though in those early stages? Well, the easiest way is with a straight leg, starting to slide that out to the side and back in. So I'm not using a lot of resistance or force. This is active motion. I'm stabilizing my core a little bit as I go here, and then I'll just push this to the outside and back in. This is a great way to begin to directly activate those damaged muscles to try to help them heal. Next one that I can do is called a bent knee fallout, where I'm just going to let that knee drop to the side and back. Now, this doesn't really use those muscles, but it shortens them because of what's happening through the joint. So this is another way of sneaking up on it. When I'm ready to begin to challenge it a little more, this is when I'm actually going to come to standing. going to stand and I can hold on to something. And if this is my injured side, I can stand on my opposite leg and just begin to do something called a hip three-way, just like that. So we've got side, forward, and backward. So pop quiz, which is harder, me standing on my uninvolved or uninjured side, moving the injured side, or standing on the injured side and moving the opposite leg? Think about it for a minute, and you know right away. I can tell you, if you do have this hip problem, you're probably going to realize it's most likely this one, because this hip is working a lot to keep my pelvis stable. That glute medius muscle, when it's firing, it helps keep this side of my hip up, just like a line across there. If this is injured or torn, my hip is going to want to drop like that because this muscle isn't able to work. So whatever I do over on this side, this is working a lot. Some other great things you can do while you're here, you can do some heel raises, just coming up on your toes. You can do single leg heel raises. These are ways of progressing some stress for that, okay? Starting easy, gradually putting a little more force through it. If you're a little further along and your tendon is tolerating it, you can go ahead and do some partial squats. And I would just say do them to a chair or a surface like this, table. So partial squats are going to be great. And then progress to the point where you can do single leg mini squats. This is a mini squat. I'm not worrying about how far down I'm going. As that gets better and stronger, you can go deeper. Okay, all the way down to the chair or table. Bring it over my step. You can see another great move. It's going to be some step ups on my injured side. Press, nice and controlled, and then finish by marching your other knee and then slowly lower. You can see I'm getting a little wobbly there, so my hip stability will work. One of the telltale signs of chronic knee dysfunction is when you watch yourself in a mirror and you go to do a little step up like this, the knee is going to want to pull in like that. And that's a sign that the hip is weak. So if you can pull your knee out, keep it aligned over your toes as you come all the way up, that is a good sign your hip is working well. Well, another great exercise I love is using a little band loop like this. Get that around one, put that around the other, and then we can do some monster walks, taking some big diagonal steps, just like that, forward, backward. As you get a little bit higher level, you can do them a little quicker. So this is going to be a little bit of a great higher level glute medius exercise. Well, folks, there's a very quick overview of some of my favorite go-to rehab exercises for the earlier stages of glute medius tear or tendonitis rehab. There are a million other exercises you can do that are progressively harder, more difficult, more challenging. Eventually, we want to get to some hopping, jumping, more explosive power moves. But for just the basics, I think this is good. And if you have this problem, hopefully you're going to find some ideas here, some things you can do that are going to give you some help. So thank you so much for joining me. If you have questions or observations about your own experience, be sure to drop them in the comment section below. And as always, hope to see you next time.